For those of you that have joined, just to let you know, we'll be recording today's meeting to share on Roots. The recording will stop for any questions at the end of the presentation, so if I could ask you to refrain from asking them until then, that would be great. The Women's Network are really excited to present today's external speaker, Eliza Wide. Eliza is here to inform us this afternoon about endometriosis disease. Eliza, if you would like to introduce yourself and get the presentation rolling, that would be great.
Thank you. So I'm Eliza from Endometriosis UK. I'm a volunteer support group leader. So I'll start with talking a little bit about my personal experience of endometriosis. So I was diagnosed with endometriosis and adenomyosis at 27, and we'll look a little bit more into what exactly they are in a moment. But I was going back and forth the GP from the age of 13 with various symptoms and didn't get a diagnosis until I was 27. So it was a long time not really understanding what was going on or what was wrong with me. Some of the symptoms that I experienced, and this can be different for everyone, but some of the symptoms I personally experienced are pelvic pain. I think that's pretty much universal, bloating, nausea, breathing difficulties, and exhaustion as well. In September 2020, I was referred to a BSGE gynecologist, and that's a British Society for Gynecological Endoscopy, and they are specialists in treating endometriosis. So I was diagnosed after many years, first through an MRI, which preliminary showed that I had endometriomas. This was before my surgery, and a thickened junctional zone. And then when I had my first laparoscopy in December, which was a few months after the MRI, they also found diffuse adenomyosis and extensive endometriosis throughout my pelvis, but also in my appendix, colon, and diaphragm as well. So the first surgery, it was mapped out because the surgeon didn't have the tools that he needed there to completely treat the complexity of it. So the second laparoscopy then, which was a few months later in April 21, this was where I had the endometriosis excised, and this was a complex surgery. And depending on where they find the endometriosis, you may need to have other specialists as well. So for example, I had a colorectal surgeon present as well as the endometriosis specialist. So it really is a multidisciplinary requirement there. So fast forward to today, I'm managing the symptoms the best I can, even though I've had surgery. Is not a cure, unfortunately. And yeah, just managing the best I can while I'm waiting on the NHS list for further treatment. And I also volunteer as a support group leader for Endometriosis UK. So just a brief overview of what we'll be covering today. So what is endometriosis, some findings and publications, what Endometriosis UK are doing, treatment and management, how to advocate for yourself, impact in the workplace, what you can do, and a little bit about Endometriosis UK and the support that we can provide. So endometriosis affects 1 in 10 women, and those assigned female at birth. And this is from puberty to menopause, although the impact may be felt throughout life. In the UK, that's over 1.5 million women from all races and ethnicities and people assigned female at birth living with this condition. So statistically, you're likely to know someone with this disease, whether that's yourself or a family member or a friend. It's as common as asthma and diabetes in women. And this is actually shocking. So 54% of the general population have never heard of endometriosis or don't know what it is. So that brings me to the next slide. I thought it'd be interesting to do a little poll on what you think endometriosis is. So if you'd like to, you can scan the QR code and take part in the poll. So there's 3 different options for what you think endometriosis might be. So I'll just give you a minute just to do this. I'm glad it's working. We've got 1 response. Oh, fabulous. Just give you a couple more seconds. Okay, so that's really good actually. So I'll just move on to the next slide. What is adenomyosis? And we have a similar setup here, another poll, but this time we're looking at what adenomyosis is versus endometriosis. So I'll just give you a minute or so. Yeah, a little bit more mixed for adenomyosis. That's interesting. I like to call adenomyosis endometriosis's ugly sister. They often co-occur, but you can have just endometriosis or just adenomyosis as well. And I will explain what they both are. I'll just give you a couple more seconds. Okay, we'll just move on to the next slide. Really good responses, everyone. So what is endometriosis? So the majority of you were right. Endometriosis occurs when cells similar to the ones in the lining of the womb are found elsewhere in the body. These cells can grow and change in response to hormones in the menstrual cycle, which can lead to inflammation, pain, scar tissue, and sensitization of the nervous system. So it's commonly found in the lining of the pelvis and may occur in the ovaries and involve other pelvic organs like the bowel or the bladder. It's also been found in many other places in the body, even in the brain or the heart. Less commonly, though, it is found outside of the pelvis. So adenomyosis is where it's very similar to endometriosis, but it's where the cells similar to the lining of the womb actually invade the muscle wall of the uterus. So instead of being found outside of the uterus, they actually start invading the muscle wall of the uterus. So some common symptoms include chronic pelvic pain, painful periods that interfere with everyday life. So this is a really important thing to understand. A lot of people might have painful periods, but if it gets to the point where you're unable to carry out your daily activities, then that is the point where you might need to seek some medical advice. Because that is not normal. It's not normal to have pain that interferes with your everyday life. So other symptoms include bowel and bladder pain, painful sex, which can be during sex or afterwards as well, heavy menstrual bleeding, fatigue with 1 or more symptoms of the above, and also difficulty getting pregnant, which is a really difficult aspect of endometriosis. But up to 70% of those with endometriosis will be able to get pregnant naturally. I'm really lucky to be a grateful mum to a healthy little boy. He's 4 now, and it was something that I never ever thought that would happen. And I got told by multiple consultants that I'd never be able to have children. So yeah, he's my little miracle. So many with endometriosis also experience significant bloating. Sorry, I'll just bring up all the symptoms that would help. Many with endometriosis experience significant bloating, and it does not go away, but it can also be a symptom of other health conditions as well. So it's really important that you see a medical professional. Sometimes endometriosis also co-occurs with other conditions that cause bloating and similar symptoms such as IBS, pelvic inflammatory disease, fibroids. I got misdiagnosed with interstitial cystitis before they found that I had endometriosis. So it is quite complicated. There's not always a straight path to endometriosis. So symptoms vary from person to person. Some people can be severe and completely debilitated, whilst others have no symptoms at all. There have been instances where people have only been investigated when they've been trying for a child, for example. They haven't had any symptoms at all, and then they've had a laparoscopy and they've found stage 4 endometriosis. So you can have no symptoms at all as well. So it's often seen as just physical pain, but it's a lot more than that. It's a chronic condition, and living with a chronic condition is completely unpredictable. So you can never predict when the pain is going to happen. Sometimes there's a pattern to it. So, for example, it'll be around ovulation or around your period. But for a lot of people, they experience these pains daily, and significant flare-ups can happen at any time. So this can often lead to anxiety, low mood, feelings of isolation, and especially when these symptoms aren't understood by family and friends or employers, or you're struggling to be believed by healthcare professionals as well. So this condition really can impact work, relationships, all aspects of your everyday life. And there's some interesting figures later on that highlight this. So moving on to the next slide. So I'll talk a little bit about diagnosis. So the only definitive way to diagnose endometriosis is by a laparoscopy. Sometimes scans are used. For example, in my story, I had an MRI and that showed endometriomas, but it doesn't always show up on scans. I want to make that very clear. And it also depends on who is interpreting the results of your scans as well, and if they've had special training to be able to recognize endometriosis. So just because it doesn't show up on a scan doesn't mean that you don't have it. But the only definitive way to diagnose it is by a laparoscopy. And this is an operation in which a camera, a laparoscope, is inserted into the pelvis via small cuts near the belly button. And the surgeon uses the camera to have a look around your pelvic organs and look for signs or patches of endometriosis. If endometriosis is diagnosed, the endometriosis may be treated or removed for further examination. So, for example, they might take a biopsy. Scans, blood tests, and internal examinations are not conclusive in diagnosing endometriosis. And like I said earlier, a normal scan, blood test, or internal examination does not mean that you do not have endometriosis. So we've got another Slido next with another poll. What is the average time to diagnose endometriosis in the UK? How long do you think it takes on average to get a diagnosis? Oh, we've got lots of responses already. Oh, it's a little bit mixed here. Oh, are people changing their minds? Are you allowed to do that? I'll just give you a couple more seconds. Okay, so we'll move on to the next slide. So Endometriosis UK have recently done a study in over 3,000 people in the UK who have been diagnosed with endometriosis since 2015, and more than half of the 3,000 were diagnosed in the last 2 years. So these findings were compared with earlier surveys from 2023 and 2020. And here we can really see how diagnosis times and experiences have changed over time. This research also included additional work with ethnically diverse communities, which is super important. and has helped highlight inequalities in access to diagnosis and care. So here are some of the findings from the report, which is absolutely staggering. And the majority of you were right. The diagnosis time average is 9 years and 4 months in the UK. And this has actually gone up from previous years. So it's gone up from 8 years in 2020 and 8 years and 10 months in 2023. And this is even higher for ethnically diverse communities, which is absolutely unacceptable. And this diagnosis average is around 11 years, which really highlights the ongoing inequalities in access to care in these communities. So this lengthy wait means a delay in access and treatment during the disease, which means that it may progress. So there's a lot of mixed research on this. So some research says that endometriosis is progressive, whilst other research evidence is that it might stay the same or it might regress on its own. So research is still a little bit mixed, but it may progress and lead to the worsening of physical symptoms and poor mental health as well. So here's a couple more interesting findings. I'm not going to go through them all now in the interest of time, but we'll send out the slides after this, so feel free to have a look at these. But yes, 83% reported being told their symptoms were normal, exaggerated, or that they were making a fuss about nothing. I personally experienced that, and it's something that I hear way too often with everyone that comes to my support group. A lot of other people that I meet with endometriosis say the same thing. It's absolutely unacceptable. It's medical gaslighting of women, and it's absolutely unacceptable. It takes a really strong woman to continuously carry on trying to get medical advice and a diagnosis when they're constantly being told you're normal, there's nothing wrong with you, you're making a fuss. So yeah, it's absolutely unacceptable, a lot of these numbers. So some more recent publications. So it was found as of late 2025, early 26, that around 743,000 women and people are on gynecology waiting lists across the UK. The number waiting for hospital gynecology services would fill Wembley Stadium an estimated 8+ times. And a recent report from RCOG found that gynecology waiting lists reduced by only 3% in the last year. So I'll talk a little bit now about treatment and management. As I previously mentioned, there is no cure for endometriosis, and the different treatments that are available aim to reduce the severity of the symptoms and improve the quality of life for someone living with this condition. So we've talked a little bit about laparoscopy before. So as a treatment for endometriosis, surgery can be used to remove endometriosis, which may alleviate pain by dividing adhesions, removing cysts, or restoring pelvic anatomy if possible, because when endometriosis progresses, you can get a lot of adhesions that can actually stick your pelvic organs to various places in the pelvis, which can be extremely painful. So one way that surgery can help is by restoring pelvic anatomy, by allowing free movement of the organs, but also putting them back in the right place. But even after surgery, symptoms may still persist or can return if the endometriosis grows back. And the way that this was communicated to me when I had my surgeries was they remove everything they can see at the time. So if you're having a laparoscopy and you're having that removed, they remove everything that they can see, everything that they're able to remove. But that doesn't mean that there aren't small deposits in other areas that they haven't been able to remove or haven't seen. You can also use hormone management. So endometriosis responds and grows when exposed to female hormone estrogen. There are a number of hormone treatments that attempt to block or reduce the production of estrogen in the body. and hormonal management aims to relieve the symptoms, but also to prevent endometriosis from growing. So there are a few different hormone treatment options that you can use. So you can use the combined oral contraceptive pill, the intrauterine system or IUS, which is often referred to as the coil. There are also progestogens and GnRH analogs, which can induce a kind of menopausal like state. But it's so important to make sure that you're aware of all of the side effects of any hormonal management that you want to take. And the same with surgery. If you're considering surgery, make sure you ask all of the questions that you have and really make use of the time before it to make sure you're informed and you have the knowledge that you need to feel comfortable with the treatment that you've chosen. Pain management is very important as well. The main symptom of endometriosis, which is mostly universal apart from the rare few that don't get symptoms, pain management is very important. There are various pain relief and pain management options available. I really find my plug-in heat pad useful. So heat can be helpful for some people. A lot of people like hot water bottles or have a hot bath, but I've got a plug-in heat pad and it's got such a long lead on it that when I'm moving from room to room, I just kind of unplug it and then plug it into whatever room I'm in, which is helpful. There's also painkillers. There's various types of painkillers available. It would be really useful if you're interested in learning more about the different pain relief options to ask for referral to a pain clinic where they can help you with pain management specifically. There's also pelvic floor physiotherapy, which I found extremely useful. I got told that I had a hypertonic pelvic floor. After the years of pain with endometriosis, my pelvic floor had kind of tightened up a lot. So physiotherapy really helped to relax that a little bit. So be careful if you are doing Kegel exercises and you suspect you have endometriosis, because it may be that you need some support from physio to help you relax those muscles. And there's also TENS machines. So I've got a couple of different TENS machines. And one thing I will say about TENS is when you find the right setting, it's amazing. But if you get the wrong setting, you're in for a lot of pain. So try different settings on different TENS machines. And if you find one that helps you, then it really, really is a huge relief. But yeah, try different settings. Don't just try one and then think that TENS is no good for you, because there are multiple options for settings. So next I'll talk a little bit about how you can advocate for yourself, and then we'll go on to talk about how you can support others with endometriosis. So I'll just bring all of these up. So the first one is GP appointment. So we know it's hard navigating GP appointments and speaking with doctors. It's yes, it's very stressful. And here are a few things that you can use that hopefully will help. So with your GP, be open and honest. You know your body best. There's lots of webinars available on Endometriosis UK. And there's one that's really useful, that is making the most out of your GP nurse appointment. So do your own research, keep a diary and a log so you're tracking your cycles and your symptoms. This is really helpful because it can indicate not just whether you have endometriosis, but also if you do have endometriosis, where that endometriosis is likely to be as well. So if it's on the bladder, on the bowel, if you have cysts, for example, trained healthcare professionals will be able to gauge that from your diary or your logs. Look at the NICE guidance. So in England, the NHS has to follow the NICE guidance on endometriosis. And that will give you an idea of what the healthcare professionals should be following as you go through the pathway. If you want to take someone with you to the appointments, whether it's a family member or a friend, then feel free to do that. I find it really useful to take somebody with me to write notes. because otherwise I get to the appointment afterwards and I just think, what did they just say? I've forgotten it all. So it's really, really useful to have someone with you, especially for support as well, because it can be quite emotional discussing this topic. Know your rights, so ask for second opinions, specific hospital referrals. So if you are interested in being seen by a BSGE specialist, you can look on the website. They have a list of tertiary centres on there, and they are trained in treating endometriosis, but also for preferred scans and treatments. Don't be afraid to advocate for yourself. If you don't want to try a certain treatment they try to offer you, that is well within your right to do that. But also seek support. Don't go through it on your own. It's a lot to go through, and it can be very emotional. So definitely seek support, and we'll talk about some ways that you can do that later on. So how to support others. I think the most important thing, I think, is just understanding the condition, know the symptoms and understand the impact of them. So the symptoms, again, are chronic pelvic pain, fatigue, bowel and bladder issues, heavy bleeding. These are the most common symptoms. And then understanding the impact, so it doesn't just impact your health, it also has an impact on your work, mental health, relationships, and fertility as well. So it's really important to listen and validate and acknowledge what somebody's feeling without minimizing their symptoms, and also believe them. Endometriosis pain is real, and I think there was something floating around about it being one of the most painful conditions on the NHS, and it's quite difficult because there are a lot of painful conditions out there, and how do you compare pain? But it's extremely painful. To put that into context, during my second surgery, I had oral morphine, and I could still feel the pain through the morphine. That's how painful it is. It's really, really painful. Ask what support they need. So everyone is different, everyone's experiences and preferences are different. So it's always good to ask. Some of my friends, a few years ago, they would ask me, oh, can I get you a hot water bottle? Can I get you a mint tea, a ginger biscuit? Yeah, ask what support they need. And if you're going to do some research, please use trusted sources. So you can use Endometriosis UK, NHS, or NICE. There are a few other trusted sources as well. You can have a look on the Endometriosis UK or the NHS websites for those. And you could also help them prepare as well for appointments. And you could do this by writing symptoms down, noticing their flare patterns, or coming up with some questions maybe that you would like to ask or that they might like to ask you think would be helpful for them. Understand the right to referral, second opinions, and treatment options. You can encourage them to advocate for themselves, or even, if you're comfortable, to advocate for them if they don't feel comfortable doing that themselves. So next we'll just talk about some practical everyday support. So flexible adjustments, so rest, pacing, remote working, quiet spaces. So just by providing these flexible adjustments, it can make such a difference and help to keep women with endometriosis in work. If it's a family or friend member, you can help with daily tasks, such as chores, or help them out during flare-ups, help them with childcare maybe, meal prep, or even things just as simple as making sure they're drinking enough water, because when you're in that much pain, the last thing you want to do is look after yourself. So you can really help by looking after them while they're really struggling with the pain. You can also support them emotionally by signposting them to counselling or to support groups at Endo UK. or come with them even. I've had a lot of people come with their friends to the support groups. Friends and families are always welcome at support groups and events as well. Yeah, attend awareness sessions as well, and creating a supportive environment. So whether this is at home, at work, or at school, it really does make such a difference. So here's a few notes on how you can make the most of your GP appointment. So I think I've mentioned this before. Write down everything your doctor says. And if possible, you could even ask if you can record the conversation, but you have to ask for permission first. You can prepare your questions in advance, and don't hesitate to ask for clarification if you don't understand something. They are there to help you make the best decisions about your health. Be proactive as well in the discussion. Share with them your concerns, your questions, and your insights, and that will give them a better understanding of your condition and how they can help you. You can also consider a follow-up appointment as well. So if you have more questions or concerns after the appointment, don't feel afraid to schedule a follow-up and ask those questions at a later date. Listen actively, so pay attention to your doctor's recommendations and explanations, which I think this is really difficult because when you get that information, it can be a bit of a shock. So I do think it is really useful to have somebody else there that's able to write things down and listen and pay attention for you if you do feel a little bit emotional or if you are in shock. So keep a symptom diary, as we've already talked about, and there are lots of symptom diaries available online that you can use. And yeah, prioritize your concerns. So focus on the main issues that you want to discuss and schedule additional appointments if needed, because unfortunately GPs don't have much time anymore. So it's really important that you prioritize. If you do run out of time, you've made sure that you've covered the most important things that you wanted to cover. There are some support and schemes available. So there's the TFL badge, the Please Offer Me a Seat badge, which is a good way to communicate with people on London Transport or other transport that you have a hidden condition. So it's ideal for people with endometriosis, especially during flare-ups, when standing for long periods can be painful, but also sitting for long periods can be painful. So you can apply online for this. It's quick, free, and you don't need medical proof. There are also some other schemes. So the Sunflower scheme, which signals that you may need some extra time and support, which is really useful. I also have an access card. I did have to pay for it. I can't remember how much it is. But I do have an access card, and that is really helpful as well. For example, I went to Disneyland Paris recently, and they recognized it there. So there are a few support schemes that are useful if you are struggling with some of the symptoms. So earlier I mentioned that there are some staggering figures on the impact of endometriosis on women. So 1 in 10 women, and those assigned female at birth, suffer from endometriosis. So that's estimated 176 million worldwide. We've already covered the average diagnosis time, which is way too long. And endometriosis is actually the second most common gynecological condition in the UK. And absenteeism due to severe period pain and heavy menstrual bleeding alongside conditions like endometriosis estimatedly cost the economy 11 billion each year. And like we've discussed previously, the cause is unknown and there is no cure. So there are some theories about what causes endometriosis, but the jury is out. The cause is still unknown. So here's some more impact figures, and I just really want to highlight they're all important, so feel free to have a look at them after this, but I just really want to highlight the top right, where women would have liked but were not offered these services in their appointments. So 90% would have liked psychological support, 87% pelvic physiotherapy, and then 58% for pain management and fertility treatment as well. So these are things that you can ask for in your appointments to get a referral for if you feel they would be helpful for you. So now I'll talk a little bit about the impact in the workplace, and we'll look a little bit closer at the stats around this. So 38% of women with endometriosis are concerned that they're going to lose their job. 35% reported reduced income, 27% say they've missed out on a promotion, and 1 in 6 actually give up work. So yeah, this really highlights how much it impacts women in the workplace. Here are some quotes from women on the impact it's had on them in the workplace. So women have felt that they've been seen as unreliable, been sacked for taking too much sick leave, they've been passed over for a promotion, or forced to quit work. So this really highlights the moments where a lack of support has had a really negative impact on individuals. So here's a quote then from a woman who's actually found that she's had the right support. And this just shows that when you have an employer that's supportive, it can enable staff to thrive. It is a really difficult condition to talk about, and I've met many women who feel like they aren't able to talk about it, especially in the workplace as well. But if you do feel comfortable in being able to open up about it, and it is very vulnerable, but you might be able to get more support that way. But I understand not everybody feels comfortable enough to do that, and you really have to do what's best for you. So some of the ways that Endometriosis UK like to work with employees and employers, and things that they like them to consider to achieve a positive outcome if you do decide to share your information. So the first one is share your information. So share information about your condition and treatment, and explain what you're experiencing and how this affects you if you feel comfortable. You can also seek advice and support, as we've spoken about, and we'll speak a little bit more about this later on. Don't assume or expect an employer to make a reasonable adjustment automatically. So be open-minded about your working arrangements. And if they no longer work for you, then speak up if you can. And try to understand the challenges from your employer's perspective as well. And then some of the things we ask employers to consider is knowledge is power. So it's important that you're aware of endometriosis, and the more you understand about endometriosis and gynecological health and its impact, the better equipped the employer is to respond effectively. So you can also consider what best practice looks like in your organization, what's already in place, what are the gaps, and what challenges might be preventing progress. And ultimately, this is about open communication, so mutual understanding and a willingness on both sides to work towards practical and supportive solutions for employees. So some of the things that your workplace can do is put in place policies and support, raise awareness of the condition, and work on some practical considerations. So policies and support facilitate conversations about individual needs, and see what flexibility can be applied to help them thrive in work. And having these policies in place as well can encourage staff members to feel they have a safe space and colleagues who understand their experiences. appropriate training for line managers, health and well-being initiatives, and acknowledging that some staff might be suffering without being diagnosed, given the diagnosis times are so long, or they might not even be aware that what they're experiencing is related to endometriosis. So just always being supportive, kind, and compassionate. So raising awareness around endometriosis at work can really help staff feel more supported. So as I've mentioned, endometriosis isn't just painful or uncomfortable during a period. Symptoms can happen at any time during the month. And that's why it's so important to take time to understand the condition properly. For someone living with a condition, it can be really such a huge relief to say to a manager or to a colleague, I have endometriosis, and to hear them say in response, I understand what that is. Let's talk about how it affects you and what we can do to support you. The simple recognition can have such a profound difference. It's also important to provide accessible mental health information across the organisation, collaborate with other organisations like Endometriosis UK, and just create a culture that actively values both physical and mental health, really challenging the stigma, encouraging these open conversations, and ensuring that knowledge is used to support people with endometriosis and not reinforce a stereotype. Because this discussions around this condition should never lead to dismissive comments or assumptions about somebody's experience. So for example, using it against them, such as, oh, they're PMSing again. So above all, it's really important to build a workplace where understanding replaces judgment, and then awareness leads to action to get better support for women experiencing these conditions. So there are also some practical everyday adjustments that can make a real difference. So even ensuring easy access to toilets and providing private spaces where someone can rest if they're experiencing pain. If anyone wears a uniform, then consider offering flexible options, including a range of sizes to accommodate bloating. So sometimes I've woken up in the morning, put on my trousers and they fit fine. And by midday or the end of the day, I've swollen up so much that I have to change my trousers to a size bigger because that's how much I've flared up just in a few hours. I've also just woken up sometimes, not had a drink of water, not eaten anything, and just flared up like this. It really is unpredictable. So it's really helpful to offer flexible scheduling and allow adjustments to working hours or duties where possible during flare-ups. And where roles are physically demanding, consider temporarily redistributing tasks or allowing frequent breaks. And on more difficult days, this might mean focusing on planning or strategy work rather than physical work. It's also important to be mindful of medical appointments. So specialist appointments can be difficult to get and are often timed around menstrual cycles. So I had a 2-year wait on the NHS waiting list. I was seen last month after waiting for 2 years. And then my consultant sent me for tests that had to be done around certain times of my menstrual cycles. So I had to leave work at lunchtime during those times because it had to be done that day. So that's important to consider. So flexibility is essential. And then thinking about equipment and travel, how staff are getting to and from work or to events, if they're expected to carry items, and if there are any ways to reduce physical strain. For example, a lot of people use suitcases. I've seen a lot of people using suitcases to carry things around instead of having a bag. And finally, making pain management resources accessible. So things like heat pads, hot water bottles, providing options such as sit-stand desks or seating during coaching sessions. So just small adjustments that can significantly improve comfort and reduce pain. And this also then will increase performance at work and make sure that the dignity of women is prioritized as well. Just want to highlight one point before we move on. So also checking in. I think this is such a professional but thoughtful thing to do as well. So if you notice that someone is looking a little bit off, or if they're a little bit quiet or different compared to usual, just check in with them. And this doesn't have to be endometriosis, but just send them a quick message, check in, how are you doing? Is there anything I can do to help? And if they do raise something with you, then check in a few weeks later and just see how they're doing. So this slide shows the difference workplace support can make for someone with endometriosis. So without understanding or adjustments, people often experience repeated absences, poor staff retention, and feelings of isolation due to the endometriosis. And this is shown with a downward arrow. But when organizations create a culture of openness, offer reasonable adjustments, and have supportive line managers with clear resources, that trajectory changes. And the upward arrow shows that people stay in work with this support, they feel valued, and they perform at their best, which benefits both the individual and the organization. And I just really want to highlight that small, compassionate changes can have a powerful impact, helping staff stay well and stay in work and thriving. So now I'll talk a little bit about Endometriosis UK and what we do. So we believe in a world where endometriosis is recognised and understood, and where the disease does not limit people's lives. We believe that everyone with endometriosis in the UK has the right to appropriate specialist treatment, regardless of their background, identity, location, or circumstance. And we believe that everyone currently living with endometriosis should have the best care as a result of new developments in treatment, and that proactive research is vital to finding the cause and hopefully one day a cure for the disease. So now I'll talk a little bit about what we do. So we campaign to drive change and improvement, create awareness to make sure that women are heard and believed. We connect by ensuring diverse experiences and perspectives are heard, breaking down isolation and providing practical help, I'll put my tongue back in, and emotional support. So we also influence. So we influence policy and decision makers, seeking to change the status quo, also with employers. So the understanding is there when it's needed, and making sure that research is on the agenda and also the funding for that research. And extremely importantly, we empower women to advocate for themselves, getting the support they need, strengthening and amplifying their voices, and providing access. And we'll talk about some of that support on the next slide. So we provide support groups, which are online and in person. Our support groups offer valuable support and information to those affected. So they are free. We don't charge. I've had a lot of people ask what happens at the support groups. So it depends on the support group. Sometimes there'll be an activity. For example, we are going to do a paint and sip, but the sip will be tea. But we'll be doing a paint and sip where we'll be painting tote bags this weekend. But usually we just have teas and coffees, some light refreshments available, and we all just have a chat about all things endometriosis, really. And there are tears, there are laughter, but we all come from there feeling very supported. It's like nice to have that community of people who understand what you're going through, because as much as people try to understand, I think it's very difficult to understand the reality of it unless you're living in it. So it's really nice to be around people who understand what it feels like. So if support groups aren't your thing, we've also got a free helpline and web chat. There's a Health Unlocked forum, an online forum. There's events that are hosted throughout the year. So I recently attended a Living with Endometriosis event at Cardiff, and we had different speakers. So we had the endometriosis nurses there, we had dietitians there, we had one of the BSGE specialists there as well. So that was a really good event, but there's lots of events going on. We have lots of resources on the website. We have webinars, downloadable materials that you can access. We also have a nurse support helpline, which is fantastic. The nurses are so experienced and they know so much. It's unbelievable. They're really knowledgeable in the topic. So you can either send your query to the nurses via email, and this is nurses@endometriosis-uk.org, but this will be in the presentation as well when it's sent out later. Or you can book a call to speak directly with one of the nurses. This is done via the website. We also have a symptom checker that's designed to check for common symptoms, and the endometriosis friendly employer scheme as well. So I'll just finish off with some key things to consider. So endometriosis is a long-term condition. The cause is still unknown and there is no cure. Symptoms, impact, and treatment options can vary from person to person. The symptoms can be cyclical, intermittent, or in some cases permanent. Knowledge is power, and there are lots of support, resources, and information available from the Endometriosis UK website, but you can also check out the NHS websites as well and the NICE guidance if you'd like more information on the endometriosis pathways for care. And now we'll move on to Q&A.
Wonderful. Thank you so much for that, Eliza. That was great. I'll just stop the recording before the Q&A start, just for privacy reasons.